Hi, my name is Chelsea Nichols and I'm an occupational therapist at Baton Rouge Rehabilitation Hospital. Today I'll be demonstrating a method for safely and correctly applying ACE wraps to the residual limb of a patient who has undergone a transtibial or below knee amputation, and then the method for applying ACE wraps to a patient who's had a transfemoral or above knee amputation. The first step to correctly applying ACE wraps on your patient is to ensure that you have selected the right size and amount of ACE wraps and that they are correctly rolled in preparation for application. For an average size adult with a below knee amputation, you will utilize at least 2 ACE wraps, usually the 4-inch and the 6-inch sizes. Make sure you don't use ACE wraps that include metal fasteners, as these are a major concern for patient harm. To correctly roll an ACE wrap, ensure that no part of the wrap touches the floor while unrolled. When using an ACE wrap with a Velcro closure, roll the Velcro piece outward first and then continue rolling the ACE wrap in the same direction. With this particular brand, if rolled correctly, you will see the logo on the outside of the ACE wrap once it's fully rolled. Place the logo to the skin to unroll the wrap. I'm going to make sure that my patient is in a position where they can reasonably maintain full knee extension and lift the leg as needed. If a dressing is needed to contain any drainage from the incision, ensure that it's in place and secured before applying your ACE wraps. The first ACE wrap you will apply is responsible for fully covering the distal portion of the limb to ensure proper distal shaping, protection of the skin and incision, and full containment of the dressing to minimize risk of infection. For my distal ACE wrap, I'm using a 4-inch wide standard length wrap. To ensure appropriate compression, make sure you're pulling the wrap only as tight as you need to allow the bandage to lay flat on the skin without wrinkles, but without stretching the ACE wrap too tight. If you are wrapping the ACE wraps too loosely on the end of the limb, you will notice ridges and wrinkles on the outside edges of the ACE wrap, like this. If you are wrapping too tightly, you will notice the bandage changing color as you're applying too much stretch to the elastic fibers, or your patient may complain of pain. To correctly apply your first ACE wrap, lay the wrap flat on the patient's skin at a sharp angle with the bulk of the roll on top of the wrap so you can unroll the bandage directly onto the patient's skin. Bring the ACE wrap all the way under the leg at a sharp angle and come back up to your starting position from behind the leg. Wrap once around the front of the leg to anchor your position, and then bring the wrap back down the leg and cover the other side of the end of the leg with this same sharp angle. I like to look at this like an X that is being crossed at the bottom of the leg. Use the remainder of the wrap to enclose any other exposed skin or dressing on the sides of the residual limb. If you have fully encompassed the distal portion of the limb, begin your figure 8 shaping. Be sure to double check that there's no visible skin or dressing at the most distal portion of the limb before applying your next ACE wrap. You will follow this same technique to cover the distal limb for patients with above knee amputations. The purpose of the second ACE wrap is to provide uniform compression for appropriate shaping and edema management to prepare the limb for future prosthetic use. Because these patients typically have still healing incisions, it's important that we use the correct wrapping technique to avoid causing any disruption in blood flow. To correctly apply a figure 8 ACE wrap, you need to remember the simple rule that anytime the ACE wrap is passing over the front of the limb, it should be unrolled at an angle, alternating each time. Anytime it's being passed over the back of the limb, it should be unrolled straight across the leg. This ensures that our crisscross pattern continues to move its way up the residual limb, preventing inappropriate fluid drainage or increased compression in any one spot that could impair healing. For this patient, I'm going to use a 6-inch wide ACE wrap to perform the shaping. I start my first angle pointing down towards the end of the limb and bring the ACE wrap straight across the back of the leg. Once I have turned the corner and am now unrolling on the front of the leg, I angle up to crisscross my first angle. Again, around the back of the leg, I unroll the wrap straight across, and then my next angle, coming in front of the leg, will be down. I continue this pattern with appropriate compression all the way up the patient's residual limb. You should always ensure that your ACE wrap ends at least 1 to 2 inches above the knee to prevent fluid buildup at that joint and decrease the risk of developing pressure wounds behind the knee. Once you have finished and ensured that your compression is appropriate, your anchor or ending point is well above the knee, and that the entire distal limb is covered, grab the top of the wrap with both hands and have your patient flex the knee to ensure that the patient still has appropriate knee flexion range. For a patient with a transfemoral or above knee amputation, you will follow all of the same steps as with the below knee technique, but you will have a different anchor. ACE wraps and shrinkers tend to slide off of these patients when they transfer or perform bed mobility, so they require an anchor around the waist in order to stay securely in place. A few things to consider with patients who will require ACE wrapping after an above-the-knee amputation is positioning and clothing management. Typically, you will need to have your patient lying flat on their back in their bed or on a mat to be able to completely wrap the limb. You will also need to consider that the patient will likely need to remove his pants, so ensure the patient will have complete privacy. If the patient is wearing a brief, simply don a new brief after you have applied your ACE wraps. If the patient is wearing underwear, you will need to thread the ACE wrap underneath the underwear to allow your patient to toilet throughout the day without soiling the wraps. For an above-the-knee amputee, you would use your 4 or 6-inch ACE wrap to complete your initial wrap to cover the distal end of the limb as you did with a below-knee amputee. For an above-knee amputee, however, you should always make sure that you're starting your figure 8 angled down to the inside of the leg. This ensures that when you wrap the anchor around the waist, you're pulling the leg into adduction to support proper alignment of the pelvis and trochanters. You can use a standard length 6-inch to begin your figure 8 wrap on the limb, working your way up the entire leg and ensuring that you're capturing all of the skin on the inside of the leg up to the groin to avoid creating an adductor roll on the inner part of the thigh. You can take a second 6-inch ACE wrap and secure it to your first wrap via the Velcro strip to give it extra length in order to correctly place your anchor, or you can utilize an extra length 6-inch ACE wrap if one is available to you. Once you have finished wrapping all of the leg, use the additional ACE wrap length to wrap once or twice around the waist and then secure back onto the leg. You can either have the patient roll to place the anchor around the waist or have them sit up in the bed or on the mat. Knowing how to appropriately wrap the residual limb of an amputee is an important clinical skill, not only for promotion of healing and protection of the incision, but also to prepare the residual limb for future prosthetic use. I hope this helped you to advance your clinical skills. Be sure to check out our website at www.brrrehab.com for more helpful videos like these in the future.